Hi everybody, my name is Sandy and today I'm going to talk to you about gallstones and how you can possibly save yourself from gallbladder removal surgery. So let's get into it. First of all, for the disclaimer that I'm required to tell you, the statements made here are not evaluated by the FDA, and this is not intended to diagnose, prescribe, recommend, or offer medical treatment. Please check with your healthcare practitioner to see if the options I've outlined in this information may be suitable for your particular case. Your doctor knows you better than anybody else, and they will definitely tell you if an herb may be harmful to you because of other medicine that you're taking, so please definitely check with your doctor. Okay, so what exactly are gallstones? Gallstones can be made up of two different materials. You can have cholesterol gallstones or what they call pigment gallstones, which is a concentrated bile stone. Gallbladder pain, if you're having gallbladder pain, is going to be on your right side up under your rib cage. Most of your important organs are up under your rib cage and very well protected, but that's where gallbladder pain comes from, is up under your rib cage on your right hand side. Some people can actually have gallstones or a poorly functioning gallbladder without having pain. It is possible for that to happen, and sometimes you wouldn't realize that there was a problem until you had like an ultrasound or something done. And then they would find, you know, gallstones or gall sludge. Sometimes you just have sludge, not actually stones. And sometimes if you have pain, sometimes it's just after you eat. Sometimes you can have pain just constantly. It does present itself in many different ways, but if you do have pain, it's going to be on your right-hand side, up under your rib cage. Every once in a while, if you have gallstones that are trying to leave your gallbladder, you may have pain on your left side as well, and that's because the stone is trying to pass from your gallbladder through the common bile duct and into your pancreas. So then your pancreas will get irritated and inflamed, and you'll have pain on your left side as well. So why do gallstones form? Cholesterol gallstones will form if you have too much cholesterol in your diet. The liver and the gallbladder can only process so much cholesterol in a day's time. So if there's too much cholesterol in your diet, it does kind of hang around in your liver and gallbladder and tends to form stones. Now, pigment gallstones are, you know, bile gallstones. So people who drink a lot of alcohol or do a lot of fasting or crash dieting, those folks would be more likely to have pigment gallstones because the bile is not being used to process the fats in your diet, because you just don't have a lot of fats in your diet because of the other things that you've been doing. Now, conventional medicine's solution is gallbladder removal surgery. That's pretty much the only thing that they consider. If you have cholesterol gallstones, sometimes, you know, if you're not able to do surgery or don't want to do surgery, they will try cholesterol lowering drugs. But for bile or pigment gallstones, conventional medicine really doesn't have an answer for that. Sometimes they will try to do like ultrasound, crushing the gallstones, something like that. But that's pretty much the only solutions that conventional medicine has. So for the herbal route to take care of gallstones, there are two different options depending on whether or not you have a lot of gallbladder pain. The first option, if you are experiencing a lot of pain, is to, as quickly as possible, add some mucilage to your digestive tract. And the two most common and most widely used, they work wonderfully, herbs for this would be marshmallow root or okra water. These would be best taken The marshmallow root can be taken as a capsule or a tincture or a tea. And the okra water, of course, is just boiling some okra and getting that slime and drinking that slime water. So these will add mucilage to your digestive tract to aid the stones in passing through your digestive system to get out of the gallbladder. So that's the most recommended approach for that. If you're not having a lot of pain, or intermittent pain that is dealable, there are some things that you can do to try to reduce the gallstones or break them up. If you have cholesterol gallstones, of course you want to reduce the cholesterol in your digestive system. So this would be done, garlic, artichoke leaf, and olive leaf are very good at reducing cholesterol. So you could take those for a little while to see if it reduces the stones and reduces the pain. If you have pigment or bile gallstones, then you would want to use stone root, gravel root, hydrangea root, something like that that is really good at dissolving the stones. And then you would do the marshmallow root or the okra water after that to try and move the stuff out of your gallbladder and out of your digestive system. For those of you who have tried garlic capsules or garlic oil like gel capsules, and you have a lot of reflux from those, I have found that garlic in a regular capsule, garlic powder in a regular capsule does not tend to cause that reflux that the garlic oil does. So they're a lot easier to take. So after about 2 to 3 weeks of using your choice of the cholesterol reducers or the bile pigment stone reducers, then you would again use the marshmallow root and along with dandelion root. Now dandelion root will increase bile production and flow. Kind of like adding some pressure to kind of push the stones through, and along with the marshmallow root and the okra water, adding the mucilage that can really help clean out your gallbladder from the stones or the sludge that's in there. So that would be the next step. And if you're prone to forming gallstones on a regular basis, you can do this treatment maybe every 6 months or once a year to try and keep your system cleaned out so that you don't have any more problems. These are not really herbs that you want to take on a long-term basis. It's more like kind of a temporary treatment to take care of the problem, and then you take a break from them for a little bit. So I do not encourage these to be taken long-term. You just want to do it as a treatment, take a long break every 6 months or once a year, and then do it again. So personal experience, my husband had a gallbladder attack about a year ago, and the pain started out kind of mild, gradually got worse over the course of a couple of days. I did not have any marshmallow root on hand. I do now. But I was able to find some frozen okra at the grocery store, and frozen okra does work. It doesn't have to be fresh. So we boiled the okra, strained it, so he just had the okra water. And after 2 or 3 days, because it took me a little while to find the okra, I had to drive quite some distance to find it. After 2 or 3 days, his pain got really bad. I did give him a cup of okra water, but shortly after he said he wanted to go to the hospital because it was just getting too unbearable for him. So we did take him to the hospital, and it was probably about 3 hours later. Of course, they had to check him in, and we were in the middle of COVID, so different procedures and everything. About 3 hours later, they did an abdominal ultrasound on him and did not find any stones. So the okra water definitely did the trick. He actually had some pancreas pain as well, pain on the right side and the left side in his pancreas. And but they didn't find any stones. So the okra water definitely did the trick. and his pain was greatly reduced just the next day. They released him from the hospital the next day, and he was doing really good. He didn't have to take any more pain medication. And so now I have him on this treatment to do about every 6 months, and he has been doing wonderful on it. Just to make sure that we don't have any more problems, we are doing it every 6 months on him, and he's been doing great. Herbs really do work. We use herbs for everything that we do. Blood pressure, cholesterol, thyroid issues. We just use herbs for everything. So they do work. I hope you enjoyed this information. And we'll see you next time. Thanks so much. Bye-bye.